This health teaching presentation is for a community nursing class at BYU-Idaho. The presenters will be teaching about influenza. My name is Cami Bowen. I've outlined my section in a frequently asked questions type format. To begin, what is influenza? According to the CDC, often referred to as the flu, seasonal influenza is a viral infection that primarily affects the respiratory system, which includes the nose, throat, and in some cases, the lungs. A few of the questions that will be answered in the presentation include: are there different types of influenza? What are the signs and symptoms? How does the flu spread? And when will symptoms start, and how long is it contagious? What are the different types of influenza? Influenza types A and B are the ones the public need to be concerned about. Influenza A is divided into subtypes and circulates, causing seasonal epidemics. In addition, type A influenza is the only type with a pandemic history. Influenza B does not have subtypes, but also circulates, causing seasonal epidemics. Influenza C is uncommon and presents with a mild illness, and according to the World Health Organization, this type of influenza is not a public health concern. Influenza D affects cattle and doesn't infect people. Next, what are the signs and symptoms of the flu? As a note, a cold typically comes on gradually with a progression of symptoms. The flu is often more sudden and severe. When comparing the flu and the cold, I've listed symptoms for each. The flu often has a fever. However, not everyone with the flu will have a fever in their list of symptoms, but a fever is more indicative of a flu versus a cold, as having a fever during a common cold is rare. Other symptoms of the flu include muscle aches and fatigue, headaches, cough, sore throat, runny or stuffy nose, vomiting, and diarrhea. Another note to go along with that: vomiting and diarrhea is possible with the flu, but it's more common in young children. Comparing it with cold signs and symptoms, a cold presents with sneezing, runny stuffy nose, sore throat, and a cough, but it's usually mild. How does the flu spread? The flu spreads through droplets and contact. An infected person can spread influenza with tiny droplets produced by sneezing, coughing, or even talking. If in close contact with another person, the droplets produced can land in the person's mouth and nose. Less common, a person may cough or sneeze on an object. The droplets can be touched and spread through contact with the person's eyes, nose, and mouth. An example of this would be touching an infected doorknob and then rubbing one's eyes. Taking flu prevention measures is crucial for personal and public health and will be covered later in this presentation. Finally, when will symptoms start and how long is the flu contagious? Exposure to symptoms. Once exposed to the influenza virus, on average, symptoms present within 2 days, but can take anywhere from 1 to 4 days. The period of contagiousness. The first 3 to 4 days of the influenza illness is when a person is the most contagious. This period of contagiousness can last 5 to 7 days after becoming sick. As a note, the influenza virus can infect others even a day before symptoms develop. Because of this, you may infect another person before you even realize that you are sick.
My name is Lisa Judd, and I'm going to talk to you today about 10 simple ways to protect your children this flu season. Here are 10 simple ways to protect your children this flu season. Number 1, wash hands. The Center for Disease Control is urging better, more frequent hand washing as the first line of defense against the flu. Hands should be washed before eating, after playing, after blowing noses, sneezing, and even after throwing out a used tissue. It is recommended that hands are rubbed with warm, soapy water for at least 20 seconds. 20 seconds is the amount of time it takes to sing happy birthday twice. Once the rubbing is completed, hands need to be rinsed well under running water and dried with a clean towel or air dried. There are many situations where hand hygiene is required, but soap and water are not available. In these situations, use a hand sanitizer. It is recommended that it should contain at least 60% alcohol. Number 2, get the flu shot. Vaccination each year is regarded as the single best way to prevent seasonal flu. Children, especially those younger than 5 years, are at a higher risk for serious flu-related complications. The flu vaccine offers the best defense against getting the flu and spreading it to others. Getting vaccinated can reduce flu illnesses, doctor's visits, missed work and missed school days, and prevent flu-related hospitalizations and deaths in children. Number 3, don't share. When someone has the flu, keep everyone's personal items separate. Avoid sharing computers, pens, papers, clothes, towels, sheets, blankets, toys, food, and eating utensils. When serving food to your children and their friends, avoid a community bowl. Don't put all the popcorn in one bowl for sharing. Instead, make individual bowls of popcorn. This decreases the chances of germs spreading. Number 4, keep your distance. Flu germs pass through the air from person to person. When a sick person coughs, sneezes, or talks, tiny drops of mucus hit the air. You can take them in through your nose and your mouth. How far away should you stay from someone who's sick? Those tiny droplets can spread out to about 6 feet, so keep your distance if you can. If you're sick, stay away from family members until you do not have a fever for 24 to 48 hours without being on medication. However, this is easier said than done because you may be contagious before you even start feeling sick. Quarantine sick family members as soon as possible until their fever breaks. If you share a bed or your children share a room, move them to separate bedrooms to sleep by themselves while they are sick. A sick person should also skip cooking and dishwashing duties, since these are easy ways to spread germs. Number 5, cover your cough. It's every mother's mantra, cover your mouth when you cough. During flu season, it's the best advice you can give any child or adult who wants to avoid the flu. It's our responsibility to cover our mouth and nose so those droplets don't go into the air and spread to other people. You should sneeze into a tissue or a paper towel. If you don't have those with you, you can sneeze into the crook of your elbow. Just make sure you put that clothing into the wash at night. Number 6, avoid crowded places. Avoid places where people are close to each other, often for stretches of time, such as shopping malls, airplanes, houses of worship, movie theaters, and subways. These are prime spots to pick up the flu. Especially avoid areas that have lots of opportunities for touching and sharing of saliva and mucus, such as ball pits, bouncy places, and indoor playgrounds. If you must go to these places, make sure you and your children wash hands afterward. Number 7, exercise. When you exercise, you increase your circulation and your blood flow through your body. The components of your immune system are also better circulated, which means your immune system has a better chance of finding an illness before it spreads. This includes seasonal influenza. According to a recent flu survey by the London School of Hygiene and tropical medicine, exercising for at least 2.5 hours each week can reduce your chances of catching the flu. The survey suggests that 100 cases of flu per 1,000 people could be prevented each year this way. Number 8, avoid communal towels. You wouldn't share a tissue with someone, but most of us forget that bathroom towels harbor germs too. When someone in your home has the flu, put out an extra hand towel for others to use, or use paper towels. This helps reduce the spread of germs. Number 9, eat and sleep well. Your body does a remarkable job protecting you from illnesses most of the time, especially when you keep your immune system in tip-top shape. If it begins to break down, the germs can attack and cause you to become ill. That's why taking care of your immune system, especially during flu season, is a must. And the best way to start is with good nutrition. That means fill up your plate with lean proteins, including chicken, fish, fat-free dairy products. Also think fats. Healthy oils help your body cells become more flexible and are able to communicate better and are better able to fight off disease. Don't forget to include fruits and vegetables and whole grains. And make sure you get rest. A few studies point to shut-eye as a way to boost the immune system, and the National Sleep Foundation says getting the right amount of sleep is part of staying well. Number 10, disinfect. Disinfecting surfaces will help kill flu germs. Cleaning and disinfecting are not the same thing. Cleaning removes germs and disinfecting destroys them. Cleaning with soap and water to remove dirt and most of the germs is usually enough. But when it comes to flu germs, you will want to disinfect for an extra level of protection. Use a household cleaner with a label that says it kills influenza viruses. If you do not have one, mix 1/4 cup of chlorine bleach into 1 gallon of hot water to disinfect surfaces. Disinfect doorknobs, light switches, handles, telephones, toys, and other surfaces people frequently touch, such as tabletops, counters, and chair backs.
Flu Vaccination by Leanne Zayu. No one likes getting sick. Getting the vaccine helps prevent you from getting the influenza virus. Even if you do get the flu, your symptoms will be less severe. There are 3 types of vaccine. Inactivated influenza vaccine, also known as IIV, comes in 2 forms, the quadrivalent influenza vaccine and the trivalent influenza vaccine. In the quadrivalent vaccine, it protects you from 4 different flu viruses. You have 2 influenza A, 2 influenza B. In the trivalent influenza vaccine, it protects you against 3 different flu viruses. Influenza A, which is the H1N1, influenza A, H3N2, the influenza B, and it's also in a high dose form. The second type of influenza vaccine is the recombinant influenza vaccine, also known as the RIV. The RIV does not contain any egg protein. This vaccination is good for people who have allergies to eggs. It is indicated for active immunization, and it's approved for 18 years old and older. The third vaccination that I would like to talk about is called the flu mist. It's an intranasally delivered medication consisting of live attenuated vaccine. It delivers a low dose of live influenza virus. It works best for children 6 years old and younger. It's an option that is going to be available for the flu season in 2018 and 19. So far, this medication actually has not been approved and has not been sold in the United States in the past 2 years. This option would be up to the physician to choose whether or not to give this type of vaccination for the children. How it works is the low dose of the virus is sprayed into the nose, which allows the body to build up antibodies to the virus. Who can get the flu vaccination? There is a vaccine for every age group. Ages 6 months through 8 years old may need up to 2 doses during the flu season. The vaccination is given in 4 weeks increments. The 6 months to the 18-year-old will receive the quadrivalent vaccine. Ages 18 to 65 and pregnant women usually will receive the trivalent standard vaccine. And then the 65 and older will use the Fluzone high dose. Where can you get the flu vaccine? You can go to the website vaccinefinder.org, type in your zip code, and they will give you a list of all areas that provides the vaccine. Your clinics, primary care physician will all offer it. Places where you don't want to go, it's going to be the emergency room. The cost of the vaccination is covered by the insurance, and if you don't have the insurance, you can still pay in cash for the vaccination, and it depends on the area that you get your vaccination, but the average is $31 to $38. Some misconception to clear up about the flu vaccine. Can you get the flu from the flu vaccine? And the answer is no. You cannot get the flu from getting the flu vaccine. I know there's a lot of people who think that every time they get the flu vaccine, they become very ill and they feel like they get the flu immediately after the vaccination. It is impossible to get the flu from the vaccination. Even if we do the live attenuated form of vaccine intranasally with the live virus, it is such a low dose that the body actually naturally will build up immunity by spraying it into the nose, and that is how viruses do enter into your system. Is it better to get the flu than the flu vaccine? And again, the answer is going to be no. People and children can get very sick, which will require hospitalization, and they actually can die from the flu. It is a very serious disease for the young and for the old, and for people with pulmonary, cardiac, or diabetes disease. You also have to remember that we need to protect the little ones. We need to protect the newborns. Ages 0 to 5 months will not be able to get the flu vaccine. Therefore, people around children, it's very important that they are vaccinated to protect the young and to protect the old also. Vaccines are needed to get the optimal protection. And the answer is yes. Our immune protection declines over time, and that is why we have to get yearly vaccination. The flu virus mutates every year. Studies have been done to try to see which vaccination will be the best and try to anticipate which virus is going to be the more prevalent virus for the year. More FYI information about the flu vaccine. High-dose vaccine for the 65 years and older is needed. Immune response declines with age. Human immune response become weak as we age. flu zone is a vaccination for people 65 years and older, and sometimes may require 2 vaccinations during the season. It takes about 2 weeks after the vaccination for antibodies to develop in the body and provide protection against the flu. And again, you cannot get the flu from the vaccination. There are many types of viruses that can cause the body to become down with cold symptoms. Is vaccine safe during pregnancy? Yes, vaccine for the flu is safe during pregnancy. A mother who has not received the flu vaccine can pass on the flu to her newborn child. Newborns are the highest risk for sickness and death. When is the best time to get the flu vaccination? October is the best time for the flu vaccination. The flu season starts from October and usually ends around May. How late in the season can you get the flu vaccination? It is always good to get the vaccination, even if it is late in the season. If you still see people with the flu symptoms, you can never be too late to get the vaccination. How does the vaccine work? The influenza vaccine teaches the body to produce antibodies against the virus. Those antibodies ideally prevent us from getting sick. But the virus can mutate, which is why vaccine makers must come up with a new formula every year. As with all medications and vaccination, there is always some possible risk of reaction to the medication. Minor problems would be soreness, redness to the injection site, cough, fever, aches, headaches, fatigue, sore, red, or itchy eyes. Major problems would be allergic reaction, including breathing problems, hoarseness and wheezing, hives, weakness, rapid heart rate, dizziness, and Guillain-Barré syndromes, which in 1 out of 2 cases maybe per million people that are vaccinated with the flu vaccine. Even though that is a risk, there is still more good to be vaccinated than those who are not. Who should not get the flu vaccine? If you have a severe life-threatening allergies to eggs, which you can get another vaccination as long as the doctor knows that if you do have an allergies to eggs, you can get the vaccination without eggs. If you have history of Guillain-Barré syndrome, if you're sick and not feeling well, and if newborns up to the age of 5 months, those are the people that are unable to get the flu vaccination.
Hi, my name is Nicole Solano. This section will focus on how to treat a child who is sick with the flu from the comfort of your home. There are some basic care actions you can take to protect your child who is sick with the flu. First of all, you should have your child stay home and get plenty of rest. Staying home will decrease your child's interaction with other bacteria and diseases while your child's immune system is weaker. This will help prevent your child from becoming more sick. Allowing your child to get plenty of rest will help your child have the energy they need for their body to fight the flu. You should also hydrate your child with plenty of oral fluids because children are at risk for becoming dehydrated while they have the flu. Lastly, you should have your sick child avoid contact with healthy people in your household in order to decrease the risk of others obtaining the flu. There are some medications that are useful for your child during the flu. Over-the-counter medications can be bought at your local pharmacy to help reduce your child's symptoms during the flu. Antivirals are prescription medications that can be bought to help treat your child's flu, since as we have learned, the flu is a virus. Acetaminophen is an over-the-counter medication that can be bought to help reduce your child's fever and help reduce body aches. Your child can take this medication every 4 to 6 hours as needed, but make sure not to give your child more than 5 doses in a 24-hour period. This table has a recommended dosage for a child based on their age and weight. This is a good reference for knowing how much acetaminophen is okay to give your child. Another over-the-counter medication that is safe to use for your child during the flu is ibuprofen. This medication also helps reduce fever and body aches. The appropriate dose for your child can be given every 6 to 8 hours as needed, but be sure not to give more than 4 doses in a 24-hour period to your child. This table provides the recommended dose for your child based on their age and weight. Make sure to note that children less than 11 pounds or 0 to 5 months should not be taking this medication. There are 3 different antivirals that can be used to treat and prevent influenza in children. The first antiviral is oseltamivir. This is used for treatment of influenza for children 2 weeks and older, and prevention for influenza for children 1 year and older. Zanamivir is used to treat influenza in children 7 years and older, and to prevent influenza in children 5 years and older. Peramivir is the last antiviral used for children. It can treat and prevent influenza in children 2 years and older. Remember, antivirals are prescription medication, so a doctor's prescription must be obtained for your child in order for them to take these medications. There are some flu medications used in adults that must be avoided in children. All children under the age of 19 should not be given aspirin. The use of aspirin in children could cause Ray's syndrome. Ray's syndrome is an adverse effect of aspirin in children, which causes confusion, swelling in the brain, and liver damage. Nasal sprays must be avoided for young children. Instead of nasal sprays, it is recommended that children use humidifiers. To help prevent upset stomachs in children, it is important to give children food before giving them medication. As we have learned previously, it is important that your child stays hydrated as they are sick with the flu. There are a few things you can do to assess if your child is adequately hydrated. First, you can monitor if your child's temperature is okay. If your child has a fever, they are more than likely to be dehydrated. There are a few methods on how to take a child's temperature. It is important to note that each of these have different normal ranges. If assessing a child's temperature by mouth, the normal range is 95.9 to 99.5 degrees Fahrenheit. By armpit, it is 97.8 to 99.5 degrees Fahrenheit. By ear, it is 96.4 to 100 degrees 0.4 Fahrenheit. And by rectum, it is 97.9 to 100.4 degrees Fahrenheit. Another way to see if your child is well hydrated is by assessing their skin. Assess their mucous membranes in their mouth to check if they are dry, and look to see if their eyes are sunken. These are signs of dehydration. Another sign of dehydration is if the child has low urine output. Keep these signs in mind while taking care of your child to see if you need to provide more oral hydration to your child to help them fight the flu. While there are many things you can do at home to help treat the flu for your child, it is important to know when you need to seek medical help. There are signs that your child needs to be brought to the hospital. These signs are if they have rapid or trouble breathing, if their skin color turns blue, if they are not drinking enough fluids, if they are not interacting with you or waking up, if they are a baby and are being irritable to the point of not wanting to be held, if they have a fever with a rash, or if their symptoms seem to improve but then return with an even worse cough and fever. We have attached to this PowerPoint a brochure handout that focuses on prevention of the flu in children. Please take a look at this handout as it might be helpful in learning how to help prevent the flu in your child. It goes over some of the main topics and main points that we want to reiterate in our PowerPoint. We hope this information is helpful for helping you protect, prevent, and treat your child when it comes to the flu.